But there's also the issue of the medical centers, and maybe that's where we need to also do a closer look, because I've just been surprised at why they balk at having a limit on the number of patients you're allowed to see each day at 50. That to me sounds like an awful lot of patients to see. So what is happening? How are they getting more than 50? How are they getting more than 65? I don't know that anyone's really given me a good answer to that. And that's what I'm sort of puzzling about, because they're trying to solve a problem, but I'm not even sure I know the nature of the problem. Okay, guys, we have more things that we want to talk about. So let me just get to the calls. We got Rick, we got Steve, we got Alex, we got Ed, and we got Brad on the line. We got a full board. So if you can't get in, don't you worry. As one person leaves, you can call us. 403-974-8255 is the number to call. And we got Rick up. Rick, go ahead. What's on your mind today?
Good afternoon, Danielle.
Hey, Rick.
Yesterday I was driving down talking about masks, and I just caught part of the conversation, but I was really amazed. And the reason I'm amazed is down the States, there's 200,000 people, I think, have died. Lots of other thousands of people all over the world has died. You don't have a medical degree, do you?
Do you?
No, of course not. But I mean, I listen to doctors, and you possibly bear a big role in people not wearing masks because they value your opinion. Even though I think every once in a while you come up with the real doozer. So, and you don't have a degree, so I don't know why you want to stick your nose in what is supposedly healthy. The Japanese are doing quite well.
I'll tell you why. Dr. Nenshi doesn't have a degree either. He's actually mayor, and he's taking a position that is against what the actual doctor, Dr. Dina Hinshaw, has said. She has said, wear a mask if you're in a position where you cannot keep 2 meters apart, but she keeps on enforcing the fact that 2 meters apart is the most important rule. I've got somebody else who sent me a note saying they were in to see their banker yesterday. He touched his face at least 20 times and then went around, grabbed things from outside, went to the photocopier. Like, that goes to my other point as well, is that it doesn't do you any good if you're not going to follow the protocols that are the most important. Don't touch your face with dirty hands and keep 6 feet apart from people. I've also got another person here, just so you understand how difficult now it's going to be for those. And I must also say, like, Airdrie and Cochrane, I think Cochrane's deciding today, Airdrie and Okotoks, they basically said, we're not doctors. We're going to leave this up to Dr. Dina Hinshaw. She has not said that there should be mandatory masks, and so we're not going to be imposing it. If she does say that, well, I guess maybe I'll say, what's your evidence? And I'll look at that, because from the beginning, she said she's looking at hospitalizations and ICU. And the number of hospitalizations has stayed low and stable. The number of ICU has stayed low and stable. We know who's at risk. So let's focus on those who are at risk. But here's the problem that retailers are going to have. It says, first of all, good on you for exposing facts rather than just stirring emotions. I own a retail business. We've been open throughout the pandemic and very busy. Every customer is served individually by one staff member from the start of their shopping until they are finished. We already have 6 feet between us and the customers, so my staff are not in masks. I talked to Alberta Health Services and medical professionals in March to seek advice. Medical professionals told me that because we were always talking, always breathing heavier, and always moving, masks would become moist. And therefore, heaven forbid, if anyone knowingly or unknowingly came in here with the virus, my staff could become a target. So that's the advice he was given by medical professionals and Alberta Health Services in March when he opened. Anyway, since this pandemic started, we've served over 45,000 people. Holy crumb. They're a very busy retail outlet. I have 25 staff, and we have not had one issue. I totally respect people's right to desire to wear a mask or not. My issue is that I now called Alberta Health Services immediately once Nenshi and company did this bylaw. Ready for this? Alberta Health Services has nothing to do with this. They weren't consulted, and they won't be responding to any complaints. They will simply forward them to city bylaw, who know nothing about our business model, our history, etc. The hypocrisy is ridiculous. There are no issues in retail businesses anymore. The issues are in bars and in private parties, yet masks aren't required where the outbreaks are happening. What are we doing? All issues should come from medical professionals, not self-serving politicians. So that's somebody who's been serving 45,000 people over this entire time since March. He told you what the medical advice he was given in March. He's now telling you AHS wants nothing to do with it. So make your own choices, my friends. Make your own judgment. That's all I can ask you to do. I've made a judgment. You can make a judgment that's different than mine, and we can still be friends.